make presentation on the other side of the coin. Mr. Paul Dart is a graduate of South Eugene High School here in Eugene. He received his medical degree from the Mayo Medical School in Rochester, Minnesota in 1984. Dr. Dart completed a family practice internship at Oregon Health Sciences University and a fellowship in allergy and environmental medicine in the Human Ecology Action Foundation of Chicago, Illinois. He began private practice in 1986 and has been practicing in Eugene full-time since 1988. His practice is limited to osteopathic manipulation and allergy environmental medicine. Dr. Dart is a member of the Pineal Academy of the American Academy of Osteopathy, and until 2007 held a membership with the American Academy of Environmental Medicine, among other memberships. He has specialized training in allergy and environmental medicine, as well as extensive training and teaching experience in the field of osteopathic manipulation. Over the past 18 months, Dr. Dart and 5 other local medical professionals have compiled a research report for the board on the health effects of radiofrequency transmissions, which he will summarize for us tonight. I'd like to thank all those involved for developing this report and for your efforts. At Dr. Dart's request, his presentation will be broken into 2 segments with a brief break in between. Questions from commissioners will be held until the completion of the second segment. Dr. Dart.
Great. If I start murmuring, say so. What I want to do is review the biological effects in the research that we did, looking at what is actually out there on this. Those of you who've been on the board for the last 2 years, you've heard people tell you, there's research showing there's problems, and you've heard people tell you, there isn't any decent research showing you problems. I'm not here to make assertions. What I want to do is just actually show you what some of the research is. And I'll be showing you research from each leg of the tripod that Dr. Valberg talked about. And I'll be showing you some research talking about mechanisms, potential mechanisms. That's my goal. The FCC guidelines on microwave exposures are not directed towards biological exposures. They do not assert safety of biological exposures. When they created these guidelines in 1999, they explicitly said that. And a great deal of research has occurred since that time. Regulatory bodies haven't kept up with this in terms of changing regulations, although the FCC right now is having an open comment period on the question of doing so. But regulatory agencies always lag somewhat behind the science. We've seen that with global warming, we saw that with ozone. So what I want to do is let you take a look at what the science is. And my goal in doing this is not to simply say to you, smart meters are evil, don't use them. My goal in this is to say to you, if you're going to use this technology, you need to think about how to minimize potential hazards from it. That's a different goal. We're going to look at 3 different things really here in this presentation. We're going to look at the evidence that RF exposures can cause acute symptoms in many individuals. Then we'll look at the evidence that RF can alter hormone physiology, increase oxidative stress in living systems. Then we'll review the evidence that those alterations in physiology can damage DNA and increase the incidence of some forms of cancer and decrease fertility in animals and in human beings. This first section is talking about acute health effects, which in their most severe form in humans are referred to as electrical hypersensitivity. Acute symptoms of RF in the United States, we became aware of this in the 1970s. The Russians started researching this matter way earlier than we did in the 1950s. And between 1953 and 1978, the Russian government harassed the US embassy in Moscow by beaming microwave radio waves at the embassy from rooftops of nearby buildings. Embassy staff experienced a statistically significant excess of several problems, including depression, irritability, difficulty in concentrating, memory loss, ear problems, skin problems, vascular problems, and other health problems. And people who were experiencing these, the symptoms increased significantly with accrued years of exposure. Exposures inside the building from this microwave were at the level of 2 to 28 microwatts per centimeter squared when they measured it, well below the FCC guidelines of 600 microwatts per centimeter squared. And a commission tabulated a great deal of data on this. The comments on the conclusions were vaguer than the data was. I'm not going to crunch all those numbers now, but this is when people in the United States started talking about the possibility of having these effects from microwaves, which they called at the time microwave sickness syndrome. And later on, in the 1990s, it began to be talked about as electrical hypersensitivity. Now, in 2001, a cell phone tower was put into the town of Lenora, Spain. And the letter A there is at the center of the tower, the site of the tower. A town of 1,900 inhabitants. And researchers collected information on health symptoms in a questionnaire from people of the city, all across the city. And they compared the results of these studies between the two inner circles here and the rest of the community. Power densities were quite low, measured in area A, and in area B, they were 10 times lower. But in both areas, they were quite below our FCC guidelines. And this is the data that they found. This is the power level, horrible number, outside the center circles. This is the power level inside. So we have these two groups. These stars on my diagrams these stars represent numbers that are statistically significant, which means that for the sample size, when you do the statistical math, the difference here is unlikely to be due to random chance. If the level of chance here, if the probability that this is a random represents a random shift is less than 5%, that's considered to be statistically significant. The printed copy of this will show you all those numbers at the bottom of it, but here I've taken them off so you don't have to read too many things. We see significant increases in the inner group in discomfort, sleep disturbance, depression, poor concentration, dizziness, irritability, headache, nausea, and appetite loss. All of those categories statistically significant based on the questionnaire of the research. In France, in 2002, a similar questionnaire was administered to a large number of people, 500 or more, and the results were evaluated and compared with where they lived in relation to the nearest cell phone towers in their community. And this is the data that was produced. Here we see people who complained often or very often, very often, complaining of the symptom of fatigue. And it's stratified here by how far away they were from the cell phone tower where they were sleeping in their home. So here, these people were greater than 300 meters from the tower. These people were less than 10 meters. And we can see here that when we get to about this distance, we have statistically significant increases in people complaining very often of fatigue, and here often or very often of fatigue. Here's the same distribution for irritability, and at closer range to the tower, we see statistical significant increases in irritability. Here we see a similar distribution for headache, sleep disruption, depression, less common, but still significantly elevated at closer proximity to the towers. Difficulty in concentration, memory loss, skin problems. Some people with EHS have burning skin with exposure. It's less common, but still more significant at closer distances. In 2003, in Shebin el-Khom, Egypt, down the Nile this is the Nile River, north of Cairo, they put the first cell phone tower into the city. And the researchers studied the health history of 85 inhabitants who lived near the tower. The tower was on top of this building, and some of the cohort of the study lived in the building, and some of them lived in the building or worked in the building. Some of them, I'm saying it wrong, 37 people lived in this building. 48 others worked in the building across the street. And they had a control group of 80 individuals who worked in a building 2 kilometers away from the towers. They matched the controls for age, sex, occupation, education level, and mobile phone use. And this is what they found in the group that was more exposed. Significant elevation of headache, memory problems, dizziness, depression, sleep disturbance, and tremors. In 2004, in Vienna, a well-populated area in Austria, and in Carinthia, a small town elsewhere in the country, researchers studied the health effects around 10 cell phone towers in these different areas. The criteria was that the towers had to be operational for greater than 2 years, that there be no local controversy about the towers, that there were no other towers nearby when possible. All these towers transmitted at 900 megahertz, and they randomly selected households within the study area and gave them performance tests, symptom questionnaires. They measured the exposure levels of the cell phone signal in the subjects' bedrooms. And then they stratified, you can stratify the data in this chart here. We're looking at people who had lower levels of exposure here, medium levels, and then the highest level of greater than 0.5 milliwatts per meter squared, which is significantly less than the FCC guideline of, what is it, 6,000? These are the levels. And the people in the highest exposure group had a significant increase in headaches, concentration difficulties, cold hands and feet, which reflect probably increased adrenal tone in their system. Palpitations trended up, but weren't statistically significant in this sample size. A research project was done in Akrotiri, Cyprus in 2005 to evaluate health effects around radar antenna in that area. And they looked at symptoms and measured RF levels in 2 communities near the radar tower, and also in a community quite a ways away from it. This community also had a cell phone tower. Here we see a graph of the measurements of the RF. This number here is very low in terms of the volts per meter, was 0.001 in that rural area. And these are the power levels in the 2 nearer communities. And these are the levels of change reported with symptoms of migraine, headaches, dizziness, and depression. In these 2 communities that were with higher levels of exposure, these higher levels are significant in relation to the rural area. In Selbitz, Bavaria in 2009, research was done to review health effects of a cell tower that was placed in the center of the city, the town, I should say. This is a Google Earth picture of Selbitz, so you can see the buildings and the trees. It's tried to make it pretty. The groups 1 and 2 here, average mean exposure level is 1.17 volts per meter for the physicists in the room, and group 3 and 4, the measurement was 0.7 volts per meter. And then what they did was they compared group 1 and 2 to group 3 and 4. And group 5 was a group that was completely outside those circles to look for various symptoms. And the 2 most exposed groups here, they saw higher levels of sleep disturbance, depression, joint problems, cardiovascular problems. These were all statistically significant. And toothache was put in as a control question. There was no significant change in that. So all these are studies where they're going into communities where there is microwave RF that's arrived in the community. They're looking to see if there are more symptoms in the higher exposed population. They're not selecting a population that's complaining of the higher exposure. These weren't tests of people with electrical hypersensitivity. They were tests of randomly selected people in the population. There are people who do complain of electrical hypersensitivity syndrome, who say, I get headaches from cell phone exposures or have other problems from that, burning skin, other things. My paper talks about that in detail. And research has been done to see what percentage of the population self-identifies as having this problem and complains of it. And here in 1997 in Sweden, it's under 2%. In 1998 in California, it was like over 3%. 2004 in Switzerland, close to 5%. 2004 in Austria, 2008 in Austria. A review looked at the prevalence of this problem in many different research studies and saw an increasing trend that reflects the time frame where the cell phone infrastructure was rolled out across Europe and North America. And the trend seems to be increasing. This point here is an extrapolation. And then the question is, if we talk about change over time in terms of standard deviations from the median, is that change going to be reaching up to a prevalence of 50% by 2020? The trend does seem to be increasing. I think that it's reasonable from these studies to suggest that there are perhaps 3 or 4% of the population that will say, I get a headache if I'm on my phone too long, or if my friend's phone's on, I get symptoms, that self-identify as having these problems. RF gives me sleep problems, etc. There's certainly other people that are having problems from RF and don't know it. These are people that self-identify as having that problem. And I have patients who we've done things to reduce RF in their environment and they start sleeping better. And they were unaware of the connection. So self-identification doesn't define the entire population. It probably defines the more extreme symptomatic people in that group, or some of them. The question of how many people completely are reacting this way, knowingly or unwittingly, I don't think there's any research that can tell us that at this time. Now I'm going to talk a little about physiology and some research on how RF can affect physiology. One thing it can do is alter hormone physiology, and in Rimbach, Bavaria, in 2004, a GSM cell phone tower was installed near the center, this small town in Bavaria. And prior to activation of the antenna, the town residents were all asked to participate in a mass screening. They measured urine levels of the stress hormones, adrenaline, noradrenaline, dopamine, and phenylethylamine in January and February of 2004. And then in July of 2004, January of 2005, and July of 2005. So they were measuring them over a year after the cell phone tower was installed in the town. They also administered a medical history and a questionnaire, a symptom questionnaire. This shows the number of town residents who had specific health complaints in January 2004, before the cell tower was installed, and in July 2005, over a year after it came online. And we see increases in sleep problems, headache, allergy, dizziness, poor concentration. I don't know what the statistical readings on these were. I couldn't figure that out from reading this. The trend's disturbing. What we do have clear is a measurement of hormone levels, and this is the adrenal hormone levels. They measured where people's bedrooms were, what the power levels were in their in-home exposure. And here, this is the community as a whole. This is like a lower, middle, and higher range of exposure levels. And with increasing exposure levels, after the tower came online in the spring of 2004, adrenaline levels went up, which adrenaline levels will go up with stress, and they never came back down to normal. They were higher in the highest exposed group. They stayed higher throughout the study. And the other hormone levels did the same thing. In interest of time, I'm not showing you all the graphs, but it'll be in your printed copy, which will be available to the public online. Now, melatonin is made in the pineal gland here, right in the middle of the head, about the shadiest place you can get in the human brain. And the pineal gland secretes melatonin at night. Light coming into your eyes suppresses melatonin secretion. When it gets dark, melatonin secretion goes up. It's what makes you feel sleepy. It's part of that. And if you put people in bright light at night, it can suppress melatonin for hours afterwards. Night shift work can suppress melatonin secretion. Now, melatonin is one of the most potent antioxidants ever found in living systems in our bodies. And melatonin at night works as an antioxidant to heal the effects of oxidative damage in human tissues. And part of how we rejuvenate at night is by these elevations in melatonin level. Now, low melatonin levels, here, this is melatonin levels, this is risk of breast cancer. Low melatonin levels are associated with higher risk of breast cancer in published studies, as traced by this is the melatonin, and this is the risk of breast cancer from this study. Women who have low levels of nocturnal melatonin are at greater risk for developing breast cancer. The IARC has declared night shift work to be a probable carcinogen for women due to the increased breast cancer risk. Just night shift work in light. That was done in 2007. Now, RF, like light, can also suppress melatonin secretion. RF at night can do that. In Switzerland, in Schwarzenberg, there was a national shortwave radio station that broadcast all over the world. It was a pretty powerful transmitter, and it operated from 1939 through to like 1998, and then they turned it off. And what these researchers did was they went in and they measured melatonin, they measured levels of RF from the transmitter in the community there. And then they measured melatonin excretion levels before and a few days after the transmitter was turned off. And after shutdown, people in higher areas of EMF exposure had a rebound. The people that had the most melatonin in the system had a big rebound after the tower was turned off. This score level is 40 units. This bar goes up to 106, somewhere up there. That was how much it rebounded in the third quartile of their data set. Morning fatigue paralleled this. People in high EMF areas reported less morning fatigue after shutdown here than they had before. So this is evidence from human exposures, one kind of leg of the tripod, that RF suppresses melatonin. In a little while we'll look at clear laboratory data that's been replicated many times showing that RF can suppress melatonin in laboratory animals. Now, microwave RF produces oxidative stress in cells. Dr. Valberg talked about the electromagnetic spectrum, and he said that gamma rays and X-rays are ionizing radiation. They can break bonds in cells. They can break DNA, and this can cause cancer. And physicists often argue that you can't get biological effects from lower levels because they don't have the intensity. We'll hear statements like what he made, that the intensity determines the biological effects. Actually, intensity creates the physical effect in terms of how much things move. The response of the organism determines the biological effect. If I pinch you, how hard I squeeze you determines the intensity, the pressure on your skin. The biological effect, what happens in your brain, in your adrenal glands, depends on a variety of factors. How well you know me, have I already done it today? Biological effects are not the same thing as physical effects. And you can get biological effects with very low intensity stimuli. Now, our body's molecules have charges. They have electrical charges. And in electromagnetic fields with fluctuating field strength, they vibrate. Molecules resonate in fluctuating electromagnetic fields. And this can have physiologic effects. What sorts of effects from this? This is still being worked out. Each molecule has its own mass. It has its own charge. It has its own resonance frequency. And the frequencies being used in microwave are variable, both in terms of the wavelength and the pulsations of it. So there's a lot we don't know about that. What we do know is that RF can increase the amount of free radicals in biological systems. This is a very crude diagram of a free radical. Most molecules have bonds that have paired electrons in the bonds. A free radical is a molecule that has an odd number. It has one electron shell with only one electron in it. And a free radical, a strong free radical, wants another electron. So it's more stable with another one. And free radicals can take electrons from other bonds. We do this all the time in our cells. We make little packages of peroxisomes with free radicals in them. And we use them to attack bacteria and tear them to pieces. This article was published 2 months ago. And it listed, this is some of 23 studies it listed, published studies in the peer-reviewed literature showing that EMF can increase flow through calcium channels in cells. Calcium usually is stronger outside the cell than it is inside the cell. This is a cartoon. This is a calcium channel. When calcium goes inside cells, it acts as a chemical messenger. And EMF signals can open up voltage-gated calcium channels, increasing calcium flow into cells, and that can stimulate nitric oxide synthetase, and it does in these experimental models, to increase nitric oxide, which increases peroxynitrite, which can produce hydroxyl radical and NO2, two potent free radicals. So by altering the amount of calcium that comes into cells, EMF can increase oxidative stress in cells. And after our break, we'll come back and I'll show you some clear and well-replicated research showing that this does occur. We're now going to take a 10-minute break. We should be back here at 4 minutes after 8.